Welcome back, fam. This is a Threshold Dinner. I thank everybody for coming and joining us today. Today, I have a few guests, as you can see, is a little bit different. And of course, we got Allie the PR in the cut.
You know what I'm saying? Yes, we
Hopefully everybody, you saw my last podcast. I was talking about healing scripture, right? And everything people need. If anybody knows, health is wealth. And spiritually, we just like in the physical realm, there's inadequate health care around, and we need to make sure we can get as close to the source of people, or the sources that can actually help fix us versus just simply treating us, right? So today I have joining me Mr. Mario Maxwell and Dr. Leroy Graham. Welcome to the show. Thank y'all for joining me. Um, You know what I'm saying? We
Thank
got to
you.
get that crowd in there. I try to put what I can in here to make it a little bit more exciting. My fan club
Good.
in the background. That's if you can hear it.
Right.
Sometimes it don't even come through. But anyway, um, Mr. Maxwell, please introduce
Yes.
yourself and let us know who you are and what you be about, man.
Well, this is what I be about. First of all, let me say this to your viewership, and I'm not trying to be Hollywood. These are transition glasses and the lights making it dim. So just so you know.
Hey, man,
But
you cool, you cool.
yes, as you said, I'm Mario Maxwell. I am a critical care nurse. I direct one of the critical care units here in town for one of the major hospitals for HCA. And I'm happy with that. I've been doing this for about 34 years with trauma, with critical care. Did U.S. Air Force, where I did CCAT is what we call it. It's critical care air transport. And some things I just can't mention. And I have some other background, but I leave it at
Hold on.
That's the CIA.
Don't try to just
You the
slide
CIA.
right past that stuff. What you mean? Just the things you can't mention. Man, you doing some experimental stuff? Is that what you talking about?
X-Men.
No.
No?
But I will
Okay.
say, I have good background. Work with some people that weren't actually there. So there you go.
Okay. Well,
You working with angels?
I know he's doing it big. All right. And Dr. Leroy Graham, it's nice to meet you. Could you please tell us about yourself?
Yeah, I'm Leroy Graham. I'm a pediatric pulmonologist doctor. I practiced pediatric pulmonary lung disease and critical care, both in the Army and subsequently in private practice. Toward the end of my private practice career, I founded Not One More Life, which is a 501c3 designed to address health disparities, particularly in disadvantaged and minority populations.
Okay. You just gonna spit it out like that, like you did it before, huh? You just gonna run through it. And people probably
I got this
man,
tickle in my throat, and I thought I'd do that before I had to drink my water.
Yeah, to start choking on. Okay, well, Not One More Life. You said it's a 501c3, Not One More Life. What was the vision behind as the creation of Not One More Life?
Well, it actually was born out of a tragedy. One of the things that I did as a pediatric pulmonologist is I took care of asthma, both in the Army and then later in private practice. And African Americans statistically have a higher prevalence of asthma, and also they suffer from excessive morbidity and mortality, a health disparity, if you will. And I lost a young man who had some of the toughest asthma I'd ever seen. He'd been to National Jewish Hospital, which is a hospital that takes care of very difficult asthmatics. I had actually trained there. And sadly, despite all our efforts, he died. And he died in a situation where he had been in a community where everyone kind of knew his asthma, everybody watched him. Family relocated to another area, perhaps the response of the school, the response of the people, the knowledge, what wasn't there. So it struck me that we needed to do something about that. And Not One More Life was born on the idea that at a community level, that we could provide actionable education for asthma and other chronic diseases among people who suffer from disparities. So rolling through getting out of the Army and then into private practice and now semi-retired in Atlanta, we've continued this mission. And Not One More Life basically partners with communities of faith and other validated community partners in the civilian sector that inculcate trust. So we have people come in, we try and teach them about their asthma and sometimes other chronic diseases, and really make them kind of accountable and active in their own care. And that's
Right.
what it is. And for us, it's a little bit of Christian ministry. We believe that one of the greatest gifts we have is our health, and we're supposed to be good stewards of that. So fast forward to now retired from the army and now in Atlanta. I'm excuse me in the excuse me excuse me was in Atlanta. Now in the Florida Panhandle. I was fortunate to join the Rho Omicron Lambda chapter of Alpha Phi Alpha and meet the distinguished brother that is also going to follow me, and we reignited uh, Not One More Life.
Awesome, awesome. Thank you for your service, sir.
Can I?
We know the what you got?
I was just gonna say, Dr. Graham, is Allison speaking. I know you're like, where is she? I'm here. I'm here in spirit. Um, I just wanted to take a moment and just say thank you for creating this organization and this initiative, this mission in life to not for people, not one more life. I mean, that in itself, the name in itself speaks volumes because there are people out there, and me being a caregiver, that's why it's personal for me. Being a caregiver to a child with a chronic illness, it's very lonely, and you really don't have all the education. You kind of have to look for it. But if you're working, and you're a single parent or whatever the case may be, even married couples, it's hard to balance that out and still learn at the same time. It's taxing, and so you guys provide a resource that's necessary in our community, and I want to thank you for keeping that in the forefront for your organization.
Thank you.
Right,
I will
right.
say it was a godsend when Dr. Graham and I met because immediately you've heard the story. You heard the origin story of Not One More Life. So as soon as I heard that, I said, well, what more do I need to be motivated to engage the community? I'm just so blessed that I have the position and association with organization like HCA and some other organizations for which I've met since I've been here in Florida. And it's a lot different. I too am a military veteran. I did 20 something years into the Air Force. And there I did a lot of which I talked about already. But it's nice to do it on the civilian side in our communities and really focus on the disparities. I mean, we see people, and when you say the disparities, sometimes you think, oh, well, these people can't afford health care and whatnot, but there's a lot of people. The students that's out there, maybe your child, you send them off to college,
Mhm.
there's some disparity there because they don't have the coverage necessarily for some for healthcare. There are other areas in our communities. We live here in Okaloosa County, and the surrounding counties, and that are really in need of a conduit to get to more definitive health care. And so, with Dr. Graham and a few other people that we have on our board, um, Terry Miles, Robert Riley, on our board, we're able to do the research, do the work
Mm.
through um, targeted research in the local communities to see where the disparities are and how best we can affect it. And we've done this now, Dr. Graham. I think this is our fifth. I don't have to think about it. It is uh,
Correct.
our fifth community health fair, and we're just excited. We're excited about being able to serve our community.
You talking about service, right? This panel, uh, other outside of Allie the PR, we're all vets, and that we know what it means to serve. And I tell people a lot, so one of the greatest work forms of anything that you can do on this planet while you're alive is an act of service to someone else, especially to something bigger than yourself. And it seems to me that veterans are one of the main groups of people who really understands that. Because whether they're in, and it seems like it doesn't stop when they're finished, when they get finished with the service to the country as a, veteran, when we get out, we still move in that same direction. We still have that same mindset. It doesn't die. It goes all the way with you, right? So I appreciate that. I thank all of you for your service. Salute to you, all of you, and
Thank
anybody
you for your
watching.
service,
Salute
all y'all.
everyone else. I thank you for your service. Um, so what would you consider is the organization's superpower? What thing is it gonna what big thing is it gonna bring? And what's the kryptonite? What's the thing that actually counters and you have to fight against so much as an organization?
Well, I think our secret power is the fact that we intentionally partner with trusted partners within the community, most likely communities of faith, organizations that have already inculcated trust. A lot of minorities across the board will tell you that um, they didn't feel worthy. They didn't feel that people took the time to explain. They talked down to
Mhm,
them.
mhm.
But by finding the right companion, the right partner that already inculcates trust is what kind of is a secret sauce of Not One More Life.
Mm.
Uh, Largely faith communities who teach people about stewardship, teach people about taking responsibility. That was what motivated me early on to start partnering with the faith communities. And pastors were all over that. In fact, one pastor jokingly told me, "So I'm all about the health of my of my clergy, and my members, because those are the only people that support the ministry, the people well enough to come to church." And he said that half in jest, but I think what he really meant was that really the church, particularly among people of color, has always been a safe site, has always been something that advocated for them. And we found that where people who don't know me or the rest of our team, they come into something sponsored by the church, they trust us. They give us information. They let us do lung function testing on them, something that even just being Black but not known to them, they might not let me do. And then the pastors teach stewardship on the back of that.
Right,
You know,
right.
let me add, if you don't mind, let me
Please.
add to that too, because what part of our superpower is to, as the board gathers and we talk about it, disparities, no guidelines, no boundaries, and so of course, we look at all our communities because disparities say, hey, it doesn't matter if you're black or white or higher in the economic chain or lower in the economic chain. So, especially in this area, I think, we all live here in Florida. So, depending on where we go, we can go to Walton County and regardless, what we like to do is target those disparities. And sometimes they are neighborhoods where we get minorities, but not all the time. Like I said, disparity doesn't know race, color, creed, sexual orientation, any of those things. And so I think our superpower is being able to help bridge some of those gaps
Mhm.
with communities service people who are already out there, communities of faith, communities and organizations like We Reign. Um, joining with those organizations have really that's a superpower and connection. So
Right. Yeah. Yeah. You mentioned We Reign. I am the VP of We Reign Sickle Corporation. Albert PR is the president, Presidente. And we about that whole disparity. Sometimes some of it I think it's kind of created by us in a way indirectly due to the fact of historically going through things. The way you're treating, you kind of want to go back, so you kind of create an atmosphere to where if I go, then I'll be treated a certain way. But if I don't go, I won't be treated a certain way, but I won't get the treatment. And then we run into the whole mindset of other people on the outside looking in. They don't think we actually are suffering the way we actually are suffering. I don't know about you, but I grew up. I went through if your bone wasn't sticking out your flesh, you don't go to the doctor.
Right.
You
right,
take a nap.
You're right.
you put some
Take a
dirt on it.
Put some
Yeah, you
Band-Aid
know,
on that,
you
man.
get
Roll
cut,
him in
you
the
just
dirt.
lick
He'll be
it
all
and
right.
just go on. You all right? You know, like what? You why would
Yeah.
you lick? You know.
Stuff
uh,
healing back wrong, and you just don't even know.
yeah, yeah. So, like you said with the
Put that
rewrite, you know,
Post-it on it.
so, Dr. Graham, you said you pulmonary. How? I mean, we have this disparity, but what about the people who actually are coming? Do we find that, especially as African Americans or Black people, however you want to consider us, is there an increase or decrease, or is it like a plateau of us actually seeking?
No, statistically, we find asthma is prevalent across all populations. But when you look at severe asthma that causes increased utilization with frequent hospitalizations and sadly a few deaths, like other chronic disease, it's a disproportionate burden among minorities and the poor.
Mm.
And the reasons for that are likely multifactorial. Part of it, obviously, is environment, part of it is poverty. But I think there's an issue that we try and inculcate a radical consumerism. Sometimes people in that situation are afraid to speak up, are afraid to ask the questions that they need to ask because someone's going to think they're stupid. So one of the things we do on Not One More Life is we say that, healthcare is important, but it really is a consumer issue and you need to demand quality. You need to give all the information you can to your provider, but you also need to hold them accountable. They say something you don't understand, you say, hey, you need to explain this to me. And I've seen many patients through my career where I said, well, did you discuss this with the doctor that referred you? He says, well, I didn't want him to think I was stupid. I didn't want her to look down on me.
Wow.
Mm-hmm.
So, yeah, so we try and teach kind of an informed consumerism, a radical consumerism. Sometimes it's worked too well because I can remember one parent came in and the doctor called me and said, man, what'd you do to that patient? She's a nice lady. She came in and got all in my face. I said, well, did she have questions that needed to be answered? He said, yeah, but I just wasn't ready for that, which
Well, get
speaks on
ready.
both sides. I think
Mm-hmm.
physicians, sometimes we think we have all the information, we speak it to life. That means it should be understood. And we don't do kind of that receptive listening to make
Mm-hmm.
sure that in point of fact, we're understood. And then you have the cultural thing where, the providers are more prevalently white than Black, and all that gets into trouble. So what Not One My Life tried to do was kind of instill this kind of informed consumerism that you should expect the same quality of outcome and service that you do if you were buying an appliance, if you were seeking some kind of service. And I know it's worked because I had some of my colleagues say, someone went to your program, Dr. Gam, and they came into my office with a whole case of the butt. What'd you do? And I said, well, did they ask questions that were inappropriate? No, but they just never were that locked in. Well, that's a good thing.
Story time.
That's good.
Do y'all have a
That's
second for a
good.
story?
I love that. You know,
Go ahead.
if I can dovetail that with Dr. Graham just said, that is when you talk about kryptonite. And I think that was the other part of the question. Um, those communities, what we're talking about, are hard to reach. Sometimes by design, sometimes not by design. Our kryptonite is getting the word out and actually contacting the people who need it the most.
Mhm.
And so, of course, we're here on your podcast. And of course, we get flyers out and we do the internet and we do word of mouth. But there are huge pockets in our communities that need help to bridge that disparity gap that we do have difficulty reaching sometimes, a lot of times, honestly. And so I think that would have to be labeled our kryptonite. How do we get to the
Okay.
people who need us the most? And by us, I'm talking about the community that can help with those disparities. I
Right,
mean,
right,
we offer services and that link mental health treatment, that link treatment for alcohol and drugs, for um, as
Diabetes.
protective shelters for battered women. We have a array of people that participate in our events that certainly those communities and those pockets of people really need and could benefit from being exposed to. So I'm hoping that your viewership who's seeing this now, if they have any reach into pockets of communities, people that you know that need help bridging that gap. And it doesn't have to be someone on the street. Like I said, it could be anybody. Um, then please let them know. Let them know about Not One More Life and some community health fairs that are going on. Like one is coming up this Saturday, by the
Right.
way, on the 25th.
Ha.
And our community of
Shameless
faith
plug.
is striving for perfection. So that's there in Fort Walton Beach, and it's huge potential to reach people that need help. And you know what? Even if you don't need help, you might know somebody that needs help. So come
Right.
on out and make sure
Bring
that
them
you
on.
Right.
see and get the word
Yeah.
out. Yes.
That's a good segue, man. I like that segue.
Come
You was
on.
talking about
Yeah.
something, you just went right back.
He went
You know,
right
I
in
didn't
it.
have to ask you for it on the time, but we're gonna mention it again. We're gonna come back to it too. But that was a good
Ah.
segue. I like that. You
Yeah.
professional,
That's why we
Yeah.
got
brother. I ain't
teams,
mad
man.
at you.
Yeah.
Yeah. So Ali PR, you said you had a story time?
Well, it was just sharing a testimony because, you know, this led right up to the testimony. So why should you attend the event? So that's the question in people's head. You
Mhm.
know, okay, they have health fairs all the time. People are pop up health fairs. The health department got health fairs. All these people have health fairs, right? Why should I come to this one? I'm gonna share my testimony, and that'll tell you why I went. I went because I need the information. Okay, when you said, Dr. Graham and Brother Mario, when y'all both said, you know, you're looking, for this disparities. I wasn't even that deep for me. I just didn't have any information on specific areas of my health, and I'm like, okay, I'm gonna go to this one because it's a one stop shop. You guys made an honest effort to try to incorporate big and small. You know, you can get information on heart disease, or about high blood pressure, all the way to the specialized care that's lacking in Oklahoma County specifically, and under surrounding areas about sickle cell. And so we appreciate you incorporating all aspects of different health disparities, in our area, and that is lacking. And they know it's lacking. They've done surveys and studies to show that it's lacking. And the county looks at it and they're like, oh, this is good information. What are you going to do about it? This information and having these kind of health fairs can give them the ammunition needed to make sure these services are brought to this area, because a lot of the specialized care, you have to go to Pensacola, you have to go other areas.
Hmm.
And getting to my testimony, I'm going to share that last year, about this time, a little bit earlier, February, end of February, early March, my child was in this situation where she was not getting adequate care. And this was even in Pensacola. I contacted Dr. Graham. I said, I don't know what's going on because she had acute chest syndrome. And I've never had to deal with that. I've dealt with pneumonia. I've dealt with other things. I've dealt with vaso-occlusive crisis. I've dealt with all these things, but this was different. And I texted him and I sent him a picture of her X-ray. Like they did a chest X-ray and stuff. And he said that she needs a breathing treatment. Nobody said anything about a breathing treatment. Nobody said anything about her lungs. They were trying to pump her full of morphine. They were trying to pump her full of hydrocodone. They were going down the list of opiates. And I said, why is that the only thing that y'all were looking at?
Just
And
pushers.
yeah, just pushers. And I said, they want her to be asleep. I'm like, you do know that opiates have respiratory, they
Mm.
depress your,
Depress.
yeah, they depress it. So I'm
Yes.
like, why are y'all doing this? So with the breathing treatment, I ordered the breathing treatment, Dr. Graham, from your retirement, wherever you were at the time when you told me that.
Yeah.
You weren't retired anymore, okay?
You unretired me.
Yeah, because you ordered that, because the doctors were not even thinking about that at all. And I'm like, why is that not the first line of defense?
Yeah. Yeah. And
Make
that,
sure that they can breathe. The oxygen
Right.
is depleting. It's sickle cell. Their red blood
Right.
cells are. Come on now.
and that's the importance
Sometimes you don't
of
know
Not
what you
One
don't
Life,
know.
right? Not One More Life. That's the
But
importance
they're
of the
supposed to know
organization.
this.
Right.
Well,
You're in the hospital.
Yeah. You would expect those are the people to tell you, because it's bad when you have to come in and
That's right.
know information that they're not telling you. But I'm coming to you because I thought you knew more than me and you gonna help me.
Right.
Why am I have to telling you? Why I have to tell you something?
Well, but the fact that your persistence, maybe
Mhm.
helped a little bit by what I said to you, I think people, particularly people of color, need to have a sense of informed consumerism
Mhm.
about healthcare and apply the same tenacity, the same expectation for
Yes.
excellence if you're buying a car. I mean, it's much more important. And I can tell you that when we first started Not One More Life, some of my colleagues, white and black, said, Dr. Graham, what did you say to this patient? I said, what do you mean? Well, they came in with a case of the butt, I won't use the word. And I said, they got in my face. And I said, well, were the questions that they asked inappropriate? Well, no, but their attitude, no, wait a minute, wait. Were the questions that you had answered before? Well, no, but
Mm-mm.
no, there's no
Mm-mm.
but.
Yeah,
So, I
always got the
think
attitude.
part of that is lighting a fire, particularly in people of color, maybe
Mhm.
people that are disadvantaged, who have been treated in a deferential way to
Mm.
speak up and be informed consumers about their care, much like if they were making a purchase of a stereo piece or something like that. And I don't really feel sad for providers that are turned off by that, because every time
Well,
they say they're turned off about it, they do actually wind up answering the questions.
Do your
You know
job.
what
you
though,
know,
Dr. Graham, you bring up a really good point, something that one day I would love to talk about, and the offshoot of that is medical bias. There's some medical biases that even in healthcare, profession. I'm a healthcare professional, and yes, I see that bias, and especially when we talk about sickle cell and some other chronic diseases. And yeah, we can get and really just do the down and dirty sometimes on what that means and how that
Mhm.
bias looks. And so you hit the nail on the head. So you have to be conscious and, as far as consumerism, and know, um,
What you're
you
getting
have to
into.
advocate for yourself sometimes. The only way to do that is
Absolutely.
get the information. Um, there was a young lady, uh, it's amazing. So a year ago, we did a health fair at the same facility the same church, that we're doing, on Saturday. And she came in and honestly, she didn't have any shoes. She was kind of a wandering person,
Mm.
came to our health fair, and she just kind of, some people may have ignored her in some other venues, but, that's why we were there. And so it ends up one of the services that we offer is case management. Case management deals with what resources are in the community.
Mhm.
The case manager who was there, one of the HCA case managers actually, talked to her for, I don't know, it had to be 2 hours for what I'm told, and over the services that's available in the community. And so what he ended up doing was able to get Meals on Wheels, some other supportive
Mhm.
agencies to this young lady. I say
Mhm.
young lady, but she was, a little bit older lady who really didn't know how to ask, what kind of help was available. And those are the type of disparities that we're talking about. And that was, in action, kind of what Not One More Life does, and especially in partnership with some of our community partners.
Mr. Mario, you just spoke on that. To not leave it so soon about the event that you said is about to happen. What could people expect when they go to this that's actually happening there, that they may actually be able to that they may have avoided at medical facilities, that they may be actually to actually partake in and get some help at the event? What kind of things can they expect to receive when they come?
See, DeCarlo knows me a little bit, y'all, and I love to talk about this because every time we do an event, I'm just blown over with the services that people bring. This iteration of health fair brings a young um, optometrist who, when he heard about the health fair, and we were talking about things that we do and test and everything else. He says, "No, yeah, no, I have this machine that will measure what we say ocular pressure, but the glaucoma test, right?" And I can't tell you the number of people and that whole string of illnesses that will affect people of all ages with their eyesight. So those kind of things, pulmonary function test, which is right
Mm.
up Dr. Graham's alley there, we get those done. We've identified asthmatics who wasn't necessarily diagnosed with asthma. Even more importantly, we've diagnosed some lung illnesses in people who did have sickle cell, that's a whole nother program
Sickle
of
chronic
Right.
lung
Right.
disease.
chronic
Yep.
lung disease. Exactly. But also nutrition. We have a nutritionist there and dietitian who will talk about healthy living, healthy foods. We have another nutrition exercise therapist that will probably do some giveaways. I'm not saying what all he has,
No,
but he'll
not
do some
Ed.
giveaways.
People love free stuff.
Yeah, we
Yes.
love it. We
Right.
love to be able to do that. We're looking to
Yeah.
do that more. But
Mhm.
he's going to talk about exercise. He's going to talk about fitness. We have the stroke team that will talk about signs and symptoms of stroke, how to prevent it, the prevalence in our community. Um, we have Okaloosa EMS, who's doing a wonderful job
Come on,
in their campaign with Narcan,
Andrew.
which is the antidote for a lot of opiates that we have on the streets right now. So
Okay.
you may not abuse drugs like that. However, it's good to know that if you have a family member, a friend, or even a stranger that may be
Yeah.
overdosing, that you actually have access to the antidote to save
Just
that person.
on that point, I'll add that first time I live in Sandestin, which is kind of a Tony place, but you got people here doing all kinds of stuff. I keep in my garage, which is a little workshop, I keep some Narcan. Okay. And there have been situations where I've heard in this nice Tony resort, somebody's OD'd on something.
Yep.
And, just to have that there, it's
Li-
very simple how you administer it to people. That can help, that can make a difference. So
What?
little things like this have big impacts.
It's not just
Yeah.
in the ghetto? What?
It's not just in the hood.
What?
Imagine,
No, that
imagine
can't
that.
be. That can't
Only got
be.
the black hair.
Oh, you have no idea.
Wait. Okay. So we got optometry, which is eyes. Is that? Am I
Yes.
correct?
Yes.
Okay.
Uh-huh.
We got
Yes.
pulmonary, which is lungs,
Mhm.
and
Mhm.
the EMS can check blood pressure and things like that, right?
Yes, sir.
And
Well, blood
we
pressure
got
and
for sickle
BMI.
cell. Okay,
Mhm.
and we got nutrition for your what you ingest and digest. As far as what you can control, a little bit of nutrients and nutrition. We got physical. We got exercise. Somebody get you moving. You can get all of
Yeah.
these things. These are things that most people have to get prescribed from the doctor for after to try to do maintenance. But that means you can come to this one place and get this stuff for free without a referral.
Right.
Oh, wait.
And
See,
more
You can get
importantly,
it.
you're going to get
the
someone.
dog
The
agrees.
dog said
The
yes.
dog agrees. The dog answers.
Yeah,
See,
the dog.
y'all.
Yeah. Tell them
But then more
again.
importantly, you're going to find.
What's the cost?
Go ahead.
What's the cost, Dr. Graham, of the
Zero.
self-care? Oh,
Free.
Zero.
okay.
Free
Free.
Free.
for free.
Yeah, I like
And,
that
and
word.
even more than what we give, you're going to find people who are going to take the time. And I was a busy practice guy. Sometimes your hand was on the door trying to finish. We're going to find people that will take the time to listen to you, to answer questions. And if they don't have the answer, they'll find a way to find out.
Mm.
So we want people to come and know the only dumb question is the one that you should have asked and didn't.
Right.
And
And
nobody's
so that
going to make
also
you feel
means
bad.
right. And so that also, like you just said, make you feel bad. So that also means the judgment is gone.
Gone.
We're not here. We come in here you're bringing this to the community to help them eliminate all the excuses that they might have had. I mean, or reasons and excuses, because sometimes it become an excuse. They just, I don't even want to go. But so you're eliminating excuses and reasons of why they may not want to go to somewhere else, or they may have felt like that wasn't going to be of any help. But now
Absolutely
they can
right.
come and get at least checked, and somebody who's non-biased and don't have anything against them, I can tell you that there's actually is something wrong with you. I can tell you that, oh no, you know what? You're actually good here. You can, and then also you're not just people just with tools. You actually have knowledge. Mr. Maxwell, I know everybody's been saying Dr. Graham, so I'm assuming people can assume, they can kind of follow with that. But Mr. Maxwell, you actually have your expertise and
Yes.
your structure, your focus and your background, right? So we don't want to just pass on that.
Absolutely.
What is it that what if we could be real specific on where you focus on? What is one of the focuses that you have?
One of the focuses that I have, being being a prior alcohol and drug counselor as well, is recovery. And we have had and will have places like Banyan House and other rehab places
Mm,
that some people may not know exist, but they
Mm,
do.
okay.
And another area of focus for me is pharmaceutical education. One of the things that we see, and I'm sure Dr. Graham sees as well, is the people who are able to go to the doctor and do multiple visits, they may have a ton of medicines, some of which will contradict the other medicine. So, and
mhm.
we don't know. You go and ask someone who's not um, in a position where they can seek medical help all the time. They'll tell you they take the little blue one and the red one and the one with the little stripe, but turns out they may be taking three different types of antihypertensive medication that's really dangerous for them. And so we have doctors of pharmacy there available for pharmaceutical counseling as well.
Question.
Um,
Mhm.
my primary focus of trauma and critical care really overlaps with Dr. Graham's specialty because he did specialize with critical care as well. And so what we call hemodynamics with the blood pressure and the
Mm,
body mass index, those things that we will be measuring at the health fair as well. Um,
Uh-oh.
just that's my wheelhouse. We did stop the bleed when we were in Crestview at Shoal River Middle School. And I'm not sure if Stop the Bleed is going to be there this time, but it's those sort of things that kind of fall into my territory that I love.
Okay.
And
Uh,
he's being very modest, I'll tell you.
That's what I was saying.
the whole pacing
But
is
he's
like,
been
come on,
let
man,
me tell
don't.
you the reality. This is the real. I've had this program for almost 10 or 12 years. I have never had a person in leadership in a hospital that can inculcate the need and the reason why his
Hello.
staff follows him. We have never been so richly staffed. He won't
Come
tell you
on.
that, but I've done this long enough. And the fact that these people come out, they actually enjoy it because they get a chance, you know, to go up to a patient, not intimidated like a doctor might make them,
Yeah,
and
they'll get
be
sued.
there and then take the time and listen to the questions and have the feeling that there is no question that is too stupid. The only stupid question I tell patients is the one that you didn't ask and you needed an answer to. And
Mhm.
that's
Mhm.
what Mario and his team have brought people like that who inculcate that kind of respect. They listen, they provide answers. And quite frankly, they've answered some questions that I couldn't answer.
Mm.
Mm, mm,
So
mm,
there.
mm.
He'll never tell you that, but I
He ain't
did.
gonna say that part.
Woo!
Now,
Yeah.
Come
Okay.
on. It's a
Okay.
moment of
All
now,
truth.
right.
now,
That's what the threshold is about. Truth.
I know.
Okay.
Now we're gonna
Yes.
get to
Yeah.
some. Now, as far as not when my life is concerned, um, uh, the time frame that you've been in existence, the organization's been in existence. How do you go about financially supporting and pushing forward to the next level on whatever you have to do? What are the hardships that you have to go through and
Right.
obstacles?
Well, yeah. Thank you for asking. We depend on volunteers, but we need equipment. And, some has come out of my pocket, some has been donated, some has come along with the people from my colleague's institution. But the point is that we find a way to do it. Now, we have written grants in the past. We're going to write some grants, some more. But we're just believing because we're doing the right thing that we're going to get the resources. But we're trying to be good stewards and we're trying to be able to take a model, show people the numbers and say, hey, the general public needs organizations like Not One More Life. Because if you're in the need of care and,
Mhm.
and the emergency room is filled with people that, but for the time of somebody taking a good history and giving them simple medicine, doesn't even need to be there, that hurts everybody, insured and uninsured. So that's our
Mhm.
Right.
secret power. And
Right.
I tell you, this is the best iteration we've had of Not One More Life because we have someone like Mario who's in leadership at his facility, and I'm getting volunteers that are coming from there that I've never had before, or that Not One Life's never had before.
I love it.
So
That's
we're
cool. That's
blessed.
awesome. Yeah. That's his
Yeah.
blessing.
Mhm.
But
We
Brother Miles, you
love the
about to say something?
I was just gonna say that thank you for that, uh, Dr. Graham. I appreciate that.
You know me well enough. I don't say
I know.
things just to make people feel good. You know that
Yeah,
much about me.
yeah. It is, I always looked at what I do as part of my calling and, just happens to be my vocation as well. So,
Mhm.
um, yeah. So thank you. But the other thing I was going to say is the things about nonprofits, whether it's us or at Not One More Life or We Reign or the other nonprofits that are out there. Um, we're not in it to to make a fortune, to make a bankroll.
Mhm.
So really, the gifts and the funds and the donations really go towards making an even more dynamic um, platform, a service to do other health fairs.
Mhm.
We're looking at some informative panels. We're looking at bringing in some speakers
Mhm.
again to try to reach those people that seem unreachable sometimes. And so that's what the donations will do. That's what the grants will do. And um,
Right.
so we keep moving along, and by the grace of God, we are able to do what we have done
5
so
years
far.
strong. 5.
Right. Okay. Now we say that. Could you tell us how can a person donate? What did they go to?
Well, right now you can go to info at not one more life not one more life inc, which is NOMLINC.org. If you email us there at info, kind of almost like info we reign, right? But it's info
Yeah.
not one more life um .org. And what that will do is express your interest, what you want to do. And we all watch that mailbox and we're able to answer that question. We do have a QR code that we'll introduce at this health fair and um, potentially on this website that's under construction right now in order to donate and to volunteer as well.
Okay.
I'll say this, the beauty of starting a nonprofit, like, a lot of people, um, think they have an idea of what it means to run a nonprofit, but they haven't started one themselves, and so just, transitioning from
Transitioning
it
from
being an idea to it being something that you are doing on a regular basis and you're staying compliant with the IRS and with the Department of
the
Agriculture and what they got to do with anything, but you have to make sure all your T's are crossed and your I's are dotted, and having that website and stuff is an advancement in your organization.
Yeah.
So
And
I applaud y'all. Yeah.
that's so very important because there are people out here who, under the guise of being a not-for-profit,
Mhm.
rip people off.
Yeah.
And there's nothing that we're hiding. Anybody can
Mm-mm.
look and see what we're doing. And
Mhm.
nobody's getting money in their pocket because,
Right.
quite frankly, I think, and Mario would probably agree with me, this gives
This
me at
gives me
age 72 and retired, this gives me joy to be able to do this, you
I
know?
told you you're
And,
not retired.
well, that's right.
We
I
done
mean,
brought you up out.
theoretically
Brought you
retired.
back now.
No, I'm not. But I'm just saying, I get as much, if not more, than I give, and I think a
Mhm.
lot of our volunteers feel the same way. And a lot of the volunteers below the level of doctors and nurses, they get to interact in
Oh,
ways that they can't sometime in the
yes.
hospital.
Mhm.
And I've come and caught some sidebar conversations and had someone, a nurse practitioner, maybe an LPN, maybe an aide, explain something to a patient much better than I ever did with all my education and boards,
Mhm.
you know,
Dr.
Yeah,
because
Graham,
there
like
they
you go.
that
talk to them
respiratory
straight up,
therapist,
like
like
a
the
respiratory
respiratory
therapist.
therapist.
Well, let me tell you
Oh,
what Dr. Graham
goodness.
really was trying to say, okay?
Right.
Mhm.
Like we be like, that went over their head, but they
That's
gotta get
good
it another
stuff,
way.
you know?
Okay.
And
Well,
and
so
see that's the thing because I think, we used to say this about asthma. Asthma is a disease of inflammation. It's also a disease of communication. It's
Huh.
important to be able to tell people, what
What's going on?
listen to them first, but then tell them what can make them better, how they can become active participants in their care. So I think Not Woman Life really tries to empower people in that respect. And the fact that it's not all a bunch of doctors, it's aides, it's nurses, it's assistants, it's people who have all kinds of jobs that sometimes might be able to pick out something that we doctors miss because the patient didn't want to appear stupid, but they'll tell them. Though I tell all patients,
Mhm.
the only stupid question is the one that you needed the answer to and you didn't ask.
right,
Mhm.
right.
Mhm.
So
You
and
know,
at this at the,
go
go
ahead.
ahead,
I'm
go ahead,
sorry.
go ahead.
No, I was just going to say when Allison was talking about starting a nonprofit, I will say one more thing just for other people that are starting one that they're passionate about. Not One More Life, I dare say that we're all really passionate about on the board. And sometimes we sit and we talk about the future. Like now, I can see what I would love for Not One More Life to be 10 years down the road. I
Mm.
could see it like it's right here and I want it, but you do have to slow yourself
Right.
down enough to realize and analyze the steps that it takes to get there. Yes, we want to help people. We want to bridge gaps in healthcare, but we want to do it the right way. We want to do it the data driven way as well.
Uh-huh.
Um, and so we spend some time really getting so excited about what we're doing and how we're doing it. But then we have to say, okay, well, wait a second. Let's make sure
Steps
that this
to it. Mhm.
Constitution says the right thing and that this, everything else, all the I's are dotted, T's are crossed, and the IRS is happy. So,
Absolutely.
Right.
Amen.
That
Don't look
part.
good in stripes.
Right.
That part.
right.
So at this time, I want to ask you something that what does success look like in 3 years for Not One My Life?
I'm
What
gonna
do
let
you
Mario go first.
what would you consider where I mean, I know it could be progressive, but what do you consider is okay, we've reached this goal. This is one of the goals we really want within 3 years.
Mario.
Oh, okay. Let me calm myself, first of all. I'll calm myself
Ah.
See how quick
because,
I did that?
because we just talked about this the other day. Of course, we have a community impact statement that kind of outlines for the forecast of what Not One More Life wants to do, and that will be publicized on our website as well because the public needs to know what we're doing and the impact that we're having. But in the next 3 years, with some of the things that we have in action right now, as far as grants and some grants that are focused on a certain aspect of healthcare that will take us into Washington County, that will take us into Walton County, that will take us into places that we haven't been able to travel yet, uh, although we know that information. So we're looking at in year two, at least doubling the
Number of
the
populace.
active participants that come through
Mm.
our health fairs. And so far, we've gotten into like 104, but we want to double that definitely within this next year. And then year two, we're looking at more of a um, more of a budget based on positive grants that allow us to be a little bit more robust in every single steps we take. So we have strived for every health fair to be more than the one that was
Uh-huh.
done previous. And so far we've been able to do that. and we keep pushing and pushing to where by year 2, I think the Chamber of Commerce will know not one more life. I think the city councils will know not one more life, and I think the people in our surrounding counties, not just stuck in Okaloosa, will have at least heard or participated in a not one more life sponsored event.
Mhm. Dr. Graham?
I can't top that. No, I
Now,
I share
okay.
the vision, and I will tell you that, and he's modest, but this is the first time I've had nurses for, but having someone in hospital leadership, is something Not One My Life has never had, and our kind of leadership is really complementary. And some of the things that Mario has said with a lot of humility are really new thought processes that are making us even better. And the coming out of the box, I had alliances with some of the healthcare systems in Atlanta when we started, but nothing like this in terms of executives, nothing like this in terms of turning out the kinds of help I have from his staff and so forth. So, I read somewhere that not for profits that survive get better by bringing more expertise and different views and so forth in it. And my ego has shrunk. I don't believe that I have all the answers. I have people like Mario and a few other of my fraternity brothers and other people that are now pouring into it. And this indeed is the best iteration of Not One More Life in the now about 12 years of its existence.
Mm, mm.
Let me
And,
let me
I would add that as far as I'm concerned, one of the things I've noticed is that a lot of people, I really wanna convey this to the audience. A lot of government agencies are slowly but surely trying to separate themselves from nonprofits, as far as finance, financially, unless they're specific, they're a little bit more specific. When it comes to healthcare, the disparity is so grand, with even with nonprofits, that the funds are but they're hard to come by. But we have to fight. When if you ever run into any organization that is health bound, they have to fight for every dollar, because people are really some people are biased. They don't want to mess with anything. If they don't think they have anything to do with them, they won't give it. And even local governments are separating themselves and distancing themselves from even having from allowing grants and things like that to be written for people to get funds like this. So, as much as you may see people come out and ask for help, it's an actual call for help. It is not just we just trying to get money. It is hard to get the funds to do the things that we can do and be able to do it as we just described. Would be given being able to give people who may not even be able to reach the hospitals. Some people are on such a fixed income that they don't really have the option of being able to get a ride to and from where they can get adequate health care. As I said before, as far as sickle cell, when people have vaso-occlusive crisis or any kind of other crisis, most of the time they have to go to Pensacola, which is over the 30-minute threshold of which the time they're supposed to get treated. And they have to leave their own. We have to leave the county in order to go and get somewhere where we may be able to find a physician that's actually tolerant and knowledgeable about sickle cell, the way they can treat them at that point. So it becomes to be it's this place is kind of like some of these places, and not just this place, but other places, they're like deserts when it comes to adequate health care. So this Not One More Life, We Reign Sickle Cell, and other organizations that are focusing on these things, don't just ignore them, please. Not, and it's not just your funds. Even when you come by and participate in it, the participation is a big thing, because if one of the things that I know, when you see a lot of people somewhere, you be like, "What's going on over there?"
Exactly.
You may not have even getting they may not get this video, right? But they might see a lot of cars, a lot of people outside, and they be like, "What's going on over there?" And the curiosity may even bring them in, and they may get something that they didn't even know they needed. So that's a big thing, right? That's a big thing that I just wanted to add to it. As a last question before we get to the point that we started closing this up, you spoke about whatever it is. How do you know? One question I have is, how do you know that organizations not like Not One Life is working? What kind of feedback do you look for or receive to know that, okay, this is it? Other than the participation, how do you know that when people leave that they actually are, good? Do you get any kind of feedback? Anybody come back in return and say, you know what? I thank you. Last time I was here, man, you really helped me. And I went to doctor, and sure enough, blah, blah, blah. Like, well, how do you know it's working?
Well, anecdotally, we do have those people come back. One of the things that I have thought about, I might even share this with Mario, is we have to get better about having people communicate after they've gone through our program. And that's something we can step up. But we have had testimonies already. So I'm pretty, over the 10 or 12 years that there's been Not One More Life, pretty confident we're having impact. But, when you get into grants and things like that, it's all about telling a story based up in facts. So we do need to get better with that. And
Hmm.
quite frankly, partnering with our media colleagues like you is the first step in that, because we want people to know we're out here and we want to be held accountable,
Right.
and I think that's how we begin to really get traction. How we begin, we've had some luck with grants, we've had some luck with donations, but I think showing that not only we're doing something good, but we're accountable with the resources people sow into that effort.
Awesome. Awesome. Mr. Maxwell, you got anything else on that?
I do. We do exit interviews, kind of how did you hear about this? What was impactful? What else would you like to see? Some of those questions where we can focus on the demographics that we're serving, as well as their perception of the need that they have, so that we're able to capture. But it's a little difficult, until you've done enough, uh, sheer numbers of programs like we put on to get repeat customers. People that will come through. Maybe they'll get connected with a physician through some of our referrals. Maybe they will, uh, you know, like with this optometrist, maybe they might choose to use him as their optometrist. But unfortunately, we don't necessarily get to hear about that. So hopefully, when this website comes up 100%, that we'll get to see some of those testimonies as people go to our website and share those experiences that they had with us.
This website, do you want any traffic? You said comes up 100%. It is up right now?
It is not up right now. We're doing
Okay, still under
some,
construction.
yes.
Okay, okay. So as far as we're concerned right now, I thank you. First of all, I want to thank y'all for coming on to the show. This is awesome to be able to get some information out to the people.
Yes.
Any last thoughts that I may not have covered in the questions, but you want to get out?
No, I think you've done an excellent job, and just it's so important for us to have partners in the media that spread the word. But I think
So
this has
speaking of
been
that, before we close out, because I think it sounds like we're winding down, I do want to go over a little bit about the Threshold Agenda, which is the show that we're on, and tell y'all a little bit more about it. And for
please.
the listeners that are just now tuning in to the Threshold Agenda through your network, a little bit about what that show is. But
Sure.
it's basically. Oh, go ahead. Did
No,
somebody
go.
say something?
No, it's just the feedback.
Okay, feedback. But just to tell you a little bit about it, it's a biblical perspective with a practical view. Um, and that's just in a nutshell. He gets on here and he talks about current events, or he talks about a lot of different things that's in his head and he needed to get it out. And it's gone through this evolution over since 2020. It's evolved into this. First it was just like a mini diary, so to speak, of things that was on his mind.
Right.
And then it's taken, he did interviews. I mean, he's always been kind of focused on, bettering the healthcare system and things like that, especially in our area. He had Dr. Gregory Seaton on there as a guest one time, and talked about mental health. We had a representative from the Oasis Center talked about HIV awareness and things like that. And so I think that this is right in line, with his mission and his purpose of his podcast. And I want to thank you guys for being his first guest on this platform. So I don't know if you knew that, but like y'all are
No,
his first guest on
on
the
this
new
platform,
platform.
right?
All
You
right.
see his video is really clear. Like, he's been working on the production quality.
Mm.
And I
Awesome.
think that he's been doing a good job of that. But for the listeners, like, go back and scroll, but like, share, subscribe, about, you know, all the things. We have to support each other in this community.
Right,
Absolutely.
right. Yeah, I do.
I didn't
I'm not
want
very good at really putting the plugs
The
in because
threshold agenda.
I be too busy trying to make sure that everybody I get my whatever my thought process out, and I forget to say, hey, don't forget to like, share, and subscribe. This is
And
the threshold agenda. I need my plugs. I need to get those in.
and I think the goal is to also get differing opinions. I don't want to only talk to people who agree with me all the time, and I think that that's important when we talk about getting what was it you just posted about training
Yeah.
for the fight.
Yeah. I said about Christians were mostly trained to be passive, and not we don't train them to fight. We have spiritual warfare, but we could talk about forgiveness and healing all the time, but we don't. How many spirits, demons have you went out there and got a hold of? Even the very disciples and apostles when they were with Jesus, they didn't just go out and pray for people to heal, and they had to go out and get some devils too. And we would sit in the church and watch them devils sit right in the church with us.
Right
We like,
next to us.
like,
It's a
man, you better
spirit.
get that
Yeah,
thing
it's
out
a
of
That's
here,
for
man.
real.
What are you doing?
That's for
Look,
real.
God,
That's
God
for real.
never moved like that. When he utterly destroyed whatever it was and got it outside the gates,
That's
you
right.
gonna get
Get it
that
out.
out of here. Not just you, the family. Y'all watched him do it. You gonna get you out of here too. We ain't gonna let you. No, a little leaven at the whole loaf. We gonna throw that in there,
Amen.
I
right?
mean, literally, like, but the stuff that we're eating is killing us. Like, it is a spirit. You know what I'm saying? Gluttony is a sin. So it's like we're not talking about just the eating portion of it, but what we're eating, what we're consuming.
Yeah,
It's a holistic approach, and I think that
Absolutely.
that's important to
yeah,
point out.
yeah. Go ahead. She had to get us in there. She's been
She
quiet
did
for a few
well.
minutes.
She did well.
I had to
Yeah.
make sure I know
So
I'm still up.
yeah. And the threshold agenda is I want to make sure that's why I called it a threshold in agenda is you got one side or the other, and I like to give people on both sides a chance to speak whatever it is. I may not agree with you, but that doesn't necessarily make me your enemy because you like mayonnaise. Because you like mayonnaise, I like mustard on my sandwich. We still hungry, aren't we? Right? You don't have to hate me because I. But I'll at least get it out because somebody may want to know more about mayonnaise. Because you come over here talking about. So when you're talking about pulmonary, any kind of heart or lung or anything else, most people really don't hear this unless they go on YouTube and they're looking for it. But when it comes to more realistic stuff, because a lot of this stuff you can't even trust anymore. What we need to know is, can I access it myself and not just hear it on social media? Can I actually do something about it? And like you said, you have people going into these doctors and now they're a little bit more informed. Some of these doctors getting a little scared. Don't get scared now. You better make sure you read up on your studies and make sure you keep up because
That's right.
this is WebMD 3.0 now. People are getting some information. They coming in armed. So, and that's good because you need
That
to
is very
stop
good.
playing with people's health. This is not a game. You can't just keep coming in here and just giving people what you think they should. You should listen to me. I'm your doctor. You ain't the only doctor on this planet. I don't have to
Informed
listen to you. I
That's
informed
right.
actually read.
consumerism. Informed
Right. I can
consumerism.
read too.
Yes.
I can listen. I can study. I can do some research. The same books you had, I could probably go get it too. So don't. You just specialize in this and you focus on this. I don't do this, so I come to ask you. You're the expert, but
Amen.
please believe I'll be asked, what's the alternative? I
Right.
want to know what else. Do I have to take that drug? Do I have to take that drug right there? Is there anything else? I have. I don't told people I have G6PD. I just found out last year. I didn't know I didn't even know it existed. I didn't know what I'd be like. I got G14 classified. Tell people.
Go ahead, but you really need to take it seriously.
Yeah. So
And
now
we
I
need
have
to
to
have
find
somebody.
out.
Yeah.
Right. So I had to find out what I can and cannot eat. This stuff could, and I figure out what the different medicines. I can't take this certain thing. I can't take that antibiotic. It can start can affect can affect me negatively. And that information is what people need to go out and find out. And they can go out and find out by organizations like yours. They
Right.
come out and they learn about it real time. You could take the, as you say, it's a lot of free stuff. You could take the information with you and keep it. And you can study and research it yourself and inform yourself because we know health is wealth. We can't pass. I don't care how much money you got, how many studies you got, how many games you got to go to the concert. If you sick, you gonna suffer. You got to take care of yourself better in every aspects of life. And I say spiritually also the same way. It's the same thing. We got to take better care of ourselves. If we're not informed, you ain't gonna get informed if you're gonna go read that book. Stop going to church and just listen to that man or woman up there talk. You better read it too.
Read the book.
Read the book. Yeah.
But
So
what you
anyway,
talked about is that's what I meant by informed healthcare consumerism.
Mhm.
You know,
yeah.
you have to go hold
Informed
your
healthcare
doctors
consumer.
accountable,
Mm-hmm.
and you have to ask questions. And the only dumb question that you asked the doctor is the one that you didn't ask and you didn't get an answer.
Mm.
That's the only
Right.
dumb.
Right.
So you
Right.
you have
And if the
to,
doctor doesn't want to talk to you and doesn't want to answer, you probably need to find a new doctor.
Find a doctor.
yeah,
It's
yeah,
nothing personal. Well, actually,
And that's
sometimes
not
it do be
easy. It's not easy though.
get a little
That's not easy.
personal.
No, it's not
easy.
easy, but I think
Yeah.
we, particularly among minorities and the poor, are very deferential. And I had a patient tell me, well, I didn't want to ask the doctor that question because they think I was stupid. And I know what was stupid was, and I didn't say it like this, but you didn't get the answer you needed. So I
Mhm.
really want
It
to
didn't click.
inculcate people to kind of hold the providers to task on that.
Mhm. Miss Maxwell, you about to say something before we go?
in that same vein that you were talking, I was going to say you have to have that same Berean spirit that you have with the word, with what you were saying. You transpose that onto your healthcare as well. Find out for yourself, look it up,
Mhm.
and be enthusiastic about it. This is, it's your life.
Yeah.
Um,
Got one.
and
Yes, got
and
one.
I was wanting to say something because be I didn't want to try to get last words in or anything like that. But let me tell you, the same thing that Dr. Graham said about me, he's being humble about some of the things that he's done. And if you don't believe me, read his book, right? Don't
Uh,
believe
uh,
me, read his
uh,
book.
Come
Wait,
on.
well, hold
Come
So,
on.
on.
so
Wait, what book?
All
What's the
right,
name
now
of
I
the
got to
book?
go get a copy of the book. Get that.
no,
Put it
no,
on.
look,
Put it on there.
You
I'm
get
just
Put it
saying,
and see if your
this
wife will bring
man,
it. Probably put it so you
Where's
can
the
see the
book,
picture
sir?
of the cover.
I'm saying, I'm
Get a
saying
copy of
this
the book.
man
Wait a
who says he's
minute.
retired.
Book.
He said
Yes,
he's retired.
Wait
He
a minute.
and he
I'm
yes,
going
just
to get
came
the
sir.
out
book.
the book.
We'll give
I'm
you a
like,
couple of seconds, Doctor
Hold on, hold
Graham.
on.
yeah, that's what retirement looks like.
Yeah.
Yeah.
Yes,
So,
sir. Yes, sir. Well, I thank y'all. I know he's coming back, but I thank y'all for coming
yeah.
on the show.
Thank
I
you.
appreciate you, and hopefully,
Yes.
when we get to other things, and I hope y'all come and grant us a little bit of grace and come back on.
Yeah.
We might have more focused topics, or even topics that may not necessarily be in the medical realm, but
Well,
you still. Here he
Yeah.
come.
Mm.
Yeah. But
Here he
we're real
come.
people. We're real people.
Yeah.
All of us involved with this, and so there you go.
breaking
All
barriers.
right. All right, lift it up a little bit more, sir, so we can get it back
Let me
up, back
see.
back up with it, so we can get the whole book in there, so people can see. Breaking Barriers: A Doctor's Journey from Broken Home to Battle-Tested Leader. Amen. Amen.
Look,
Breaking
this
Barriers.
Come on with it.
Available on
I'm
Amazon and Barnes and
Hmm.
Noble online.
There
yeah.
you go. There you go. Get that plug
Come
in.
on,
Look,
Var.
Hey,
you ain't hurting me. You helping.
You helping somebody.
You helping somebody.
yeah,
Amen. All right. All
it's a
right.
good
Breaking
book.
Thank you so much.
Barriers.
Learn
Yes,
about
sir.
Dr.
Yeah, he's
Graham. It's
been
a
on.
good book.
He was throwing it over, keeping it over on you, but
I got a little book, man. You can publish author and stuff.
Mhm.
All right. Well,
Thank you for that
hearts and
opportunity.
minds. So once again, right before we leave, give all the information that we had to contact you or your organization in the ways that we can. And if even if you personally, if people can contact you personally or get to somebody else that you may know that they may be able to get to, that they may be outside of the reach of this area, but they can still contact you or get information from you.
Sure. Give you an email. Does that work?
Yes. Yeah. Go ahead.
LMG254 at Gmail. LMG254 at Gmail. That's mine.
Okay.
And I think we all may have, Dr. Graham, the Not One More Life email. So again, for
Okay.
our organization itself is info, right? Info at nomlinc.org. And then for most of us, and I think all of us, including you, Dr. Graham, has,
Okay.
for me, it would be m.maxwell at, again, Not One More Life, nomlinc.org. And that will,
That'd be L.Graham, Graham, at, right?
yes.
Yeah.
Yes.
See, that's
Okay.
why. See, I need people to help me.
Hey, that's
That's
what
all
that's
right.
what it's
I
all
love
about.
it.
It's all
I
about
love it.
helping.
Yes.
Well, I thank y'all for coming out and joining me. I
Thank you
hope
for the
everybody
opportunity.
yes, sir. I hope everybody was watching. You got some information Please like, share, and subscribe, since I didn't say this this time, to the Threshold Agenda. And if you have any other comments or subjects you want to talk about, you want to get to, please put your comment in the comment section. I will. I want to welcome y'all again. I want to invite you back to return again sometime. Mr. Dr. Graham, you was gone. You mind coming on again?
Recap.
I'd be more than happy to.
I appreciate that. And if you would like to, any of the audience, if you would like to see them come in and maybe ask some more questions so we can get back to them,
Sure.
put that in the comment section. Alex, PR,
And
you got anything?
we'll be at our event, and we're always available to talk at the event.
There you go. If you're in the local area, in the Northwest Florida area, we put as a matter of fact, I'll put in the description, in the description box, I'll put the information to get to the event.
Yeah.
April
do.
25th, Striving for Perfection, 11 to 3. And what time is it?
From 10 till 3.
10 to 3.
10 to
10 to 3.
3.
You got to get an extra hour in there.
Driving
10
for
to
Perfection
3.
on Bass
Yes,
Avenue.
yes.
Striving for Perfection Ministries. Amen. Amen.
Palm Beach, Florida.
Yeah.
Well,
Let's go.
all hearts and minds clear?
Yes.
Amen.
We good?
Yes.
All right. Well, y'all
Thank you
have
so
a
much for the
blessed night.
opportunity.
Yes, sir.
Yes.
So thank you
You're
for
doing
joining
a
me.
great job.
Y'all have a
Dr.
blessed
Will.
night. And as I say to
blessed as
everybody,
well.
be blessed.
Amen.